Welcome back to another episode of The Grapevine. We are excited to have you today. My name is Susan.
My name is Ronza.
And I'm Susie.
And we have a very special guest with us today, and I'll have her introduce herself.
My name is Riham Sadiq. I am a child and adult and adolescent psychiatrist. I did my residency in Chicago and did my fellowship at USF in Tampa, and I currently live and work in the Tampa area.
Awesome. Thank you for being here with us today. I appreciate it.
You're welcome. Well,
the topic we picked today, we could talk about so many different topics with a doctor, but today we are going to talk about ADHD, or full word is Attention Deficit Hyperactivity Disorder, or sometimes they call it ADD. So first off, could you explain to us what is ADD or what is ADHD?
Okay, so ADHD, Attention Deficit Hyperactivity Disorder, by the way, there is no such a thing as ADD. It's all called ADHD. There are types, and I'll explain that. ADHD is a brain disease. It's a brain illness that affects kids and adults. And it basically has to do with certain chemicals in the brain being lacking or less than they should be in the amount. And these are the dopamine and the norepinephrine. These are the main ones.
Okay, now sounds easy when you say it, but what would it look like if somebody was to have it? What are the signs and symptoms?
Okay, so let's talk about first why the ADHD versus ADD and the types of it. So there are three main types. The inattentive type, which that person will primarily have issues with paying attention and focusing. There is the hyperactive or impulsive type, and there is a combined type, the person who has all three together. As far as what it would look like or how it manifests, okay, so of course it depends on the type. If someone has the inattentive type only, that person will not be hyper or impulsive, but will have significant problems and difficulties focusing, paying attention, maintaining or sustaining attention on a task being given. That person might be very forgetful. They forget where they put things. They forget their stuff at school. They're always losing things. So primarily have an issue with, paying attention or focusing on maintaining that attention. If someone has the hyperactive part of it, this person will be very hyper, very active, lots of energy, running around, somewhat uncontrollable. They will be fidgeting all the time, moving around. They can't sit still, even if they're sitting in a seat. Something has to be moving all the time. The impulsive part is when that person has problems controlling their impulses. They come out of nowhere and hit somebody or grab something, or you tell them don't do something in specific, and the first thing they do is that particular thing that you just told them not to do.
So how do you decipher that from someone who's autistic? Isn't that also kind of symptoms for
There is definitely an overlap.
autism?
There is definitely an overlap in the symptoms between the two. And that is why if someone is diagnosed with autism, we kind of assume they have the ADHD features. So we don't diagnose both. We don't give them both diagnoses.
That's interesting. So how do you diagnose it then? Because
ADHD?
Because I know that when I'm hearing these things, I'm thinking about my children or a lot of children. It sounds like, they're pretty common things that children have.
Well, you always have to keep in mind that these, like you said, these features or symptoms can be present in many people. But the question is really, is this a disorder? Is it crossing to the point that it's affecting their life, affecting their ability to function in school or at work or in sports or anything like that? So you always have to look at the intensity. Do they just have a problem in one area and not the other? Is it mild? Is it more severe? And based on that, you really decide if this is a disorder that we need to treat or someone who's just having a problem, like someone who's just hyper. But they're able to function and they're fine and nobody complains about them. Answering your question about how is it diagnosed, probably like most mental illnesses, it's a clinical diagnosis. You evaluate the patient, you listen to what the family and the person has to say. In the ADHD, though, we have to hear that they're having the same symptoms and having difficulty functioning in at least 2 different settings. meaning that if the child only has a problem at school, but at home they are fine, that's not ADHD. There is a problem, there is something going on in that particular setting at school. So it has to be school and home, or home and church, or school and sports, at least 2 settings. But basically it's a clinical diagnosis based on collecting symptoms from the patient, observation, and collecting symptoms from the parent or the school teacher. There are some tests, but they're not necessary to make the diagnosis. They might aid or help to do. Some of these tests are performed on the computer, and you just do it in the office. You have the child sit at a computer, and you give them specific instructions, and then it gives you an evaluation at the end. There are also scales, like questionnaires, we give to the parent or the family or the school teacher, and they fill it, and based on the answers, we kind of have an idea. But again, at the end of the day, not one particular thing you can diagnose. It's a collective picture.
So does it ever get misdiagnosed then?
Oh, absolutely. Gets misdiagnosed all the time. It gets, actually, autism and ADHD can, like I said, they overlap, so one of them can be mistaken for the other. Also, in a little bit older children, bipolar disorder can look very much like ADHD and vice versa, so that can also be missed. And anxiety can also have similar features. If someone is really anxious, they might appear hyper, fidgeting, moving all the time, and not able to pay attention because their mind is so busy thinking about what they're worried about. So yes, absolutely it can get misdiagnosed.
I have a question. So do you do the diagnosis over a certain period of time? Like, let's say you give the questionnaires to the teacher and to the parents, and you tell them, let's say, over 1 week or 2 weeks? Because honestly, I mean, I'm a pharmacist, and I tend to feel right now that I'm not sure if it's only within the United States or if it's other countries too. I feel like ADHD, I'm not sure. Exactly. It's overdiagnosed. Like
everybody's on it.
Exactly.
That's like the number one thing we dispense.
And unfortunately, we know that treatment includes narcotics. And I would always ask myself, like, do you really need the narcotics? Because we understand that for a child to start on the narcotics on age of 6 or 7, by the time they get to be a teenager, they are already used to it. I mean, and then how can you draw the line? How can you say, you know what, it's time for you to stop it because you grew out of it, or it just became a habit and that's the way, I mean, I will be better just by taking it. How you can't even now tell, should this teenage stop, or he just got used to it and he cannot live without it, or you see what I'm saying?
There are definitely multiple factors involved. Okay, is ADHD overdiagnosed? I don't know. I mean, the statistics don't say that it is overdiagnosed. That's what I can tell you. We feel that it is because we diagnose so many people, but there are factors involved in that. First of all, maybe impatience on the parents' side. Parents are stressed out, they have work demands, life demands, so they're not able to put up with a hyper child. So that child might get diagnosed with ADHD and be put on medication just because the parent is unable to handle it. The school is the same thing. The teacher has multiple kids in the class, and she has certain demands and deadlines, and she's not able to put up with a rambunctious child who is, causing a problem and preventing her from meeting what she has to do. So that's another thing. Now, the availability of child psychiatrists. We have child psychiatrists now. Maybe 30 years ago, that didn't exist. Okay? So just taking a child to see a psychiatrist, that was unheard of before, but now it is. The criteria of the diagnosis of the ADHD itself changes every, so often, and with the different books coming out, DSM-4, now 5, so some of the criteria slightly change, and sometimes that makes a difference in capturing more people or capturing less people, and so on. So yeah, I know most people feel that it is overdiagnosed. However, there are factors involved. Now, putting them on medications, that's a whole different topic we can talk about. But I see where you're coming from, and that's why myself as a child psychiatrist, I'm not so quick to put kids on medications. I mean, you really have to have a problem, and that problem has to manifest in two settings and has to be severe enough that you're either failing in school, you're not able to perform at all, you're going to be kicked out of your team because the coach can't put up with you not paying attention and not listening to instructions anymore. So like, it has to be something significant.
So I'm sorry, so basically it has to be like kind of severe level.
Yes.
So you start basically by psychotherapy or more of...
Okay, this is a very good point. After the evaluation, let me just make this very clear. We said that this is a disorder of the brain, right? Mm-hmm. And it has to do with chemicals in the brain lacking. So the studies proved that doing therapy, whatever kind of therapy you can do with an ADHD child, is not going to fix the ADHD. Mm-hmm. If you need dopamine, you need dopamine, okay? In other illnesses, though, like depression, we do scans of the brain before and after, and we find that the therapy has similar effects on the brain in these illnesses like the medications. So we definitely recommend therapy for those illnesses. But for ADHD, that's not the case.
Oh, that's really interesting.
So the only treatment available is medication.
So you're saying in the last 30 years there's been child psychiatrists, but before there wasn't. So it was underdiagnosed before?
I believe it was.
So what was the treatment before? Did they just put them
I think before it was called other things. I mean, I believe that we still had ADHD, but it wasn't recognized as ADHD. It wasn't recognized as an illness. These kids were called bad kids. They were just punished, maybe spanked, and they just had to survive, you know. The ones that had the problem with attention, they just gave up on school. They said, well, I'm not good in school. And they dropped out or did something else, found another path in life. But I do believe that the illness was present.
So there's 3 different ways that ADHD, you said, can be, right? So if a child is just very hyper, let's say, and a parent chooses to not medicate them, is that going to harm their child or is it going to help them? Like, let's say they're just like, you know what, I'm going to take them out to a soccer field every day and they're going to run laps. Get that energy out.
And we encourage patients to try that. If that's what you think is going to help, try it. And if it succeeds, perfect, then you have your solution. But if it doesn't, and the child is so hyper and clumsy that she or he gets hurt every day, broken bones, things like that, and every injury, you know, you have the consequences and the time off from school to heal and all of that. If this is a problem, then you need to put them on the medications. You have to weigh the risk and the benefits.
Yeah, that makes a lot of sense. So are there any risk factors that could make you more prone to having ADHD?
Okay, well, genetics, for sure, as all mental illnesses. It's not hereditary, but it runs in families. That's the best way to really explain it. Do we have a specific cause for it? No, we don't. We don't. But you do definitely see it runs in families.
So do you know what it is, what kind of gene carries it, or I don't really know what is the right
There
terminology?
is no specific gene. Okay. No, there is no specific genes. Now, other things, risk factors. Born premature, that's a risk factor. Having difficulties during birth, having the oxygen cut off during birth, that's a risk factor. Being exposed to drugs or alcohol in utero when the mom is pregnant, that's a risk factor. So some things like that. Any neurological deficits that the child will encounter in like the early stages of life, whether in utero or after that. You know, someone who had seizures when they were very young and were having multiple ones, they're more likely to have ADHD. So there are things that put you at risk for sure, but there's not a specific cause.
It's really interesting. I didn't realize all those things were causes, but when you look at the chemicals in the brain,
Right.
and you say the risk factors, they all make sense.
Yes.
Okay, I have another question came to my mind. So, did it ever happen to you that maybe a child was referred to you by a teacher or by a parent, and after diagnosis and checking the child, you felt like he or she is not really hyper, but it's just like, I mean, it's normal. It's just that the parents or the teacher or both can't handle that the child is a little bit hyperactive, but really not ADHD and does not need maybe treatment.
Right.
It just need more of accommodate the patient to the.
Yes, that happens, and sometimes I say to the parents that yeah, he does or she does have some form of ADHD or hyperactivity, but it's not really severe enough to require medication. So let's handle it in other ways for now, and as long as we're going fine, we leave it like that. The school offers accommodations. There's something called IEP, Individualized Educational Plan. That's something the parent had to go to the school system and request it. Then by law, you're entitled to it. And there's also something called 504 plan. And we recommend these all the time for ADHD children, whether we put them on medication or not. But they're accommodations the school offers you because we consider ADHD a disability. So the school offers you certain accommodation, like you're entitled to sit in the front of the class, not in the back, to be closer to the teacher, more time on testing. You might require more prompting, that the teacher will have to come to you and say, hey, tap and focus, work on this, giving them shorter assignments at a time instead of giving them 10 things to do, because they do have tendency to do the first one or two and forget the rest, and so on. So there are some accommodations, and they do help sometimes.
That's good.
That's really amazing, actually, because I think what I'm realizing is the importance of a child psychiatrist if you're on the fence with it, because there are probably a lot of people who either one just think their child is bad, like, oh, we need to put the iron fist down. We must discipline them harder and more because they're not focusing, But to think that there may be a true imbalance, and maybe, like you said, Ronza, they don't need medication, but they could be, those accommodations could be given so that, not medicating, but they're still being helped.
And you also know your child. If you know that your child has a problem, you learn ways to work with him or her to help them achieve what they need to achieve. And instead of asking them, for example, and this is just an example, and instead of asking them to sit for 2 hours to do homework, you know that my child cannot sit for 2 hours. So I'm going to break it up for him or her and do 15 minutes at a time and give them a break and go do something else, and so on. So you learn ways to deal with it.
Right. So let me ask you, how about when it comes to countries or people that are coming from other countries, who is more likely to have it based on statistics? Like, how you always hear parents when they're like, when you see wild children in the church, oh, well, that's how the Egyptian kids are. Are they ADHD, or is it bad parenting, or is it that, maybe we have a high rate of ADHD with Egyptian kids?
No, I think we have, and I'm gonna be, oh my God, I'm gonna be attacked for saying this, but we definitely do have higher rates of bad parenting in people, especially the people who just moved in here from Egypt, and they're not used to what's customary here, what's appropriate, what's acceptable. Yeah, we have a problem with that. Now, statistics-wise, is it common in the U.S. versus Canada versus Europe versus Egypt?
No, yes.
No. There is no. I think it's universal. Right. Now, is it diagnosed more here than Egypt? Absolutely, because
we believe in child psychiatry.
And we have it available at every corner. Where in Egypt, you might have to travel to go see a child psychiatrist, even if you even know of one, because. When I go to Egypt, I say I'm a child psychiatrist, and people look at me like, what is that? What do you do?
What child needs a psychiatrist? What are you talking about?
Exactly. So, the availability is definitely a factor.
It's very interesting. So you think, first, hands down, make sure we're disciplining our children so that we have a true sense of, really, is this behavioral, or is this really neurological?
Right. And if there is one tip that I can give parents, One tip for good parenting: consistency.
Consistency.
Consistency. If you do it, even hypothetically, even if you do the wrong thing, but you do it consistently, you are more likely to capture the problem because you're following the same technique.
Oh, very interesting. Gave us something to think about there. So, can ADHD be dangerous? Like, can it be something that's dangerous? Can it be something that's detrimental? Or is it just not a big deal if they don't figure out they have it?
No, it is very dangerous. And I'll tell you why. Especially if it goes untreated. Okay. Treated ADHD is something that's very manageable. And of course, as all mental illnesses, it is not something we have a cure for. So we have a treatment, we have management, but we don't have a cure. So something that you're going to have for a while. Some kids grow out of it and some don't. About 50-50.
That's actually, I was going to ask that question too.
Right.
Like, are you a lifer? Do you have it for life?
About 50-50. About 50-50. And even some people get diagnosed much later in life. Okay. But why is it dangerous? Because imagine if you have an untreated illness like that, that's affecting your ability to focus, and you're always performing poorly in school. You're maybe bullied because you're not performing that well. Everybody's mad at you because your grades are bad. So you become anxious and you become depressed. And later on in life, when you're 13 or 14, you might reach out for drugs to treat that depression, or reach out for drugs to make you focus better so that you're not blamed, yelled at, and punished all the time for poor grades. So the rate of drug addiction and alcohol addiction in untreated ADHD is definitely significantly high.
Wow.
So if you have a child with ADHD and you know they have ADHD, and you're kind of on the fence, should I treat it with medication or not? You gotta consider that, because later on, if the problem is really there and you can't offer them the fix, they'll find the fix somewhere else. Because it's no fun to live with. It's no fun to live with all the time being wrong, being in trouble, and feeling incapable. Like, I can't even remember a simple list for 2 minutes. That's just ridiculous. And then also the rates of car accidents, car crashes, it goes definitely high when you can pay attention and you're very distractible on the road. So these are the two major risks, I would say, that you might encounter if you leave the illness untreated.
So if you leave it untreated, does it get progressively worse, progressively more severe, or
you
can't
really, there's no way to predict that.
How about if you start the treatment early and you really feel this child needs it, and you do start it, and everything, like the parents and the school are punctual and everything goes okay, is there not chances that the child cure? Is when we used to study it, at least in pharmacy school, they used to tell us that 25% will cure, or
grow out of it,
reach teenage level, or
they might they might grow out of it. Yes.
But is
that's
this
possible.
really true, or
It is true. Some, like I said, 50-50. About I'm talking about the treated people. 50-50 of the treated people might get better later on in life and not need to be on medication anymore.
Do we know why that is?
No, there is no rhyme or reason for it. It's just statistics, observations.
so it's not really starting to treat early, or
No,
does treating
no.
early plays a factor?
No, of course, treating early allows you to benefit in other areas. For example, if the child is going to school, and the early years of school, this is where you get your foundation of knowledge, math skills, science, and so on, language skills. If you're not treating at that stage, and that child is now in 5th grade or 6th grade, and he doesn't have that good base, he or she is going to struggle for a long time. So you better treat them early so that they can actually grasp the information they need.
And like you said,
So
the
that's
confidence level.
Exactly.
Like the confidence level, the self-esteem, you're building it up during that time. And like, you know, if you're constantly being grounded and disciplined and maybe...
And then if you wait long enough, you will not be treating only ADHD. You may be treating ADHD plus an anxiety and depression. So it makes it more difficult.
It's really interesting.
Or drugs, yes.
So I know we talked about in different countries what are the rates of ADHD and all of that, but do you see it more common in boys or girls, or is there anything to show that it's more common in boys or girls?
No, there is no statistics. Girls tended to have the inattentive type more, but having ADHD versus no ADHD,
basically like even in the way they're diagnosed.
Yeah.
So you can
It's just a type that's boys are more, they have more the hyperactive. The girls tended to go kind of under the radar because if they're not just inattentive and sitting quietly but not paying attention, they may go for a while not noticed. So
they are the quiet girls, I guess.
yes.
Okay, so basically girls tend to be the
Inattentive.
inattentive, and boys are the hyperactive, jumping around.
Boys get the inattentive too, but they're just more likely to be the hyperactive or combined, because there's a combined type. Remember, you can have both, definitely.
Interesting. So, and it's funny because, like, I don't know about you, but when I was in pharmacy school, like, I didn't realize there were really 3 types, I guess. Maybe I wasn't paying attention in that lecture. Yeah. But, you know, I didn't realize that it could be inattentive or hyper, you know, and then there could be the combination. So that's really interesting because I always look at the hyper kid and that's the one you question.
Where in the past, in previous versions of the DSM, it was called the part that did not have the hyper component was called the ADD. Now they
stopped using
took
that.
they took that out and everything is ADHD.
So I was paying attention. They changed it on us.
Why did they change that? What is exactly the reason why they took out ADD and it's ADHD? If it's not always hyperactivity.
You want the honest answer to that?
Yes, please.
Okay. It's
any answer will do.
Political reasons. Because it's how they come up with the DSM 4 or 5. It's a whole process of different people getting paid to do it. Different people advocating for one thing or another. It might not have any scientific basis to it, but they make it look like it is.
That's funny.
Well, like climate change.
It's all political.
Yeah, you know.
So that's really interesting. So if you had to give us like a couple of takeaways for parents when it comes to ADHD and the importance of whatever it is, diagnosis, anything, what would it be?
Here, very important point. Do not think that because your child has ADHD, the child is not smart. There is no correlation between the two at all. They're 2 different things. And at the same time, don't think because they are smart, they are never going to have ADHD. Because I hear that from parents all the time. But he is so smart. How can he have Yeah, you can be very smart, but your brain is wired differently. You just need a little bit of help to be able to do what we do without any assistance. The other thing that is always like, it's a misconception. The parents say, for example, but if they're playing video games, they pay attention very well. So that means they cannot have ADHD. That's not true. If you're interested and invested in one topic, on one thing or one activity, even if you do have ADHD, you're definitely going to pay attention better. So if you do great playing cards or doing video games, or if you're very good in one subject and not the others, that doesn't mean you don't have it. You might have it still, but because you love that topic or you love that activity so much, it's easier for you to pay attention.
Very interesting.
So these are 2 things that I would like the parents to be aware of.
That's great. Well, thank you so much for coming to speak with us today. I know I definitely learned a lot, and hopefully we can have you on some future episodes.
Yes, sure, absolutely.
Thank you for joining us for another episode of The Grapevine.
Thank you.
Bye.
Bye.